It's time for another health check as we are going to take a look at chronic obstructive pulmonary disease, also known as COPD and emphysema. I'm joined by interventional pulmonologist Dr. Roshen Mathew with WVU Medicine Camden Clark Medical Center to learn more. Dr. Mathew, thank you so much for joining me.
Thanks for having me.
Of course. Now, Dr. Mathew, these are diseases that are important for people to learn about. So can you tell us a little bit about what COPD is and emphysema?
So COPD is chronic obstructive pulmonary disease, and emphysema is a subtype of COPD with the lung having a lot of destruction with air trapping and bullous disease.
Okay, and so can you tell us some of the symptoms, things that may be warning red flags, signs that people may need to look out for as they might have contracted this?
Yes, usually with COPD or emphysema, you have a lot of difficulty breathing on a day-to-day basis, doing routine work or routine things that you do, chronic cough and phlegm. So those are some of the red flags that you need to watch out for. So at that point, you need to go to your primary care doctor and try to talk to them, maybe get a lung function test or x-ray to screen for if you really have COPD.
And so when would you say would be that moment that maybe you should go get screened?
If you have these recurring symptoms most days and things that you usually could do easily becomes more difficult to do because of your difficulty with breathing.
Okay.
At that point, you need to look at it and get evaluated.
Absolutely. So I want to ask too, is there a difference between COPD and emphysema? Because I know COPD is kind of the overarching and then it's a subtitle potentially, but is there really like a difference?
Yes, so like you said, the COPD is the whole big umbrella. So inside that you have the subtype of emphysema with more bullous disease, and then you have a subtype called chronic bronchitis where you have a lot more coughing, which is usually the predominant symptom. While in emphysema, you have more difficulty with breathing.
Okay, and so how can people kind of treat these conditions? Are they irreversible, or is this something that, kind of sticks with you for the rest of your life then?
So these are chronic diseases. It doesn't completely go away, but if you find it out early, the symptoms can be controlled with what we call bronchodilators. Those are medicines that you take on a regular basis. And then by treating symptoms, if you have an infection in the lung, and then finding out if you have COPD, to train your body to get used to what you have, what we call pulmonary rehab. And sometimes, if the disease is so severe, you will also need things like oxygen. And when it comes to that time frame, you usually lose a lot of your lung function.
Right. So I want to ask you too, what is a Zephyr valve device and how can people with this device, how can it help them?
So Zephyr valve is a FDA approved device, and especially now under the COPD guidelines, it is a recommended product. Now it's been tested widely in Europe and in the US, and we have extensive literature on it proving its worth. So it's a device, a one-way valve that you put in the damaged or the emphysematous part of your lung to collapse the lung so that the good part of your lung can try to, expand, not grow into, but expand into that space. And it also offloads your diaphragm and helps you breathe much better.
Okay, so it sounds like it's a super helpful device. Now, maybe to help prevent people from even having to buy this device, what are ways to help people prevent them from getting COPD or emphysema? Is it to maybe stop smoking? Are there other kinds of things?
So smoking usually is the biggest culprit. So if you stop smoking, there are patients asking me, hey, will I get a complete reversal of my lung? No, but at least the disease won't progress to the point of you having more trouble with your breathing. And then also you need to take care to exercise and to train your body to get used to it. Now there are some other conditions besides smoking, also being exposed to dust, wood fuels, sometimes in West Virginia region being exposed to coal mines on a regular basis, and sometimes very rarely you also have a familial disorder called alpha-1 antitrypsin, which can actually cause COPD.
Okay, so before I let you go, Dr. Mathew, is there anything else about COPD or emphysema you'd like to share with the viewers?
So before, when COPD was severe, we had no other option besides just bronchodilators and oxygen and pulmonary rehab. Then we had lung volume reduction surgery, which had a high mortality rate. So these new devices that are there, it's not for everybody, but you need to get tested out to make sure that if you have enough air trapping or you have an emphysematous subtype of COPD, then you probably might be a candidate for the Zephyr valve. So these are some things that is out there, and a lot of patients do get benefit out of it. So get evaluated with your lung doctor, or primarily just go to your primary care doctor and see them to make sure whether you have COPD or not.
Well, Dr. Mathew, thank you so much for sitting down with me and sharing all this great information with us. It was a pleasure to learn more about COPD and emphysema with you.
Thank you very much.
Of course. When we come back, Mid-Ohio Valley meteorologist Kirk Greenfield has one last look at your forecast. Stay with us.